As the world celebrates 2019 World Breastfeeding Week, mothers are advised to adopt exclusive breastfeeding in spite of their busy work schedules. This year, the World Health Organization is working with UNICEF and partners to promote the importance of family-friendly policies to encourage breastfeeding.
That one is very simple now. There is a means they are doing it at the general where you can do exclusive. You can put it in a cup, cover it, then you put it inside the fridge. Even you are giving your child to a nanny, you put it, there is a flask that you can put it there. When their needs come, you can easily go there and the nanny will take it and breastfeed. So it's not exclusive for workers. They are also involved.
Yes, we always encourage them to express breast milk in a cup and keep it, especially maybe want to take the baby to daycare, or they have nanny at home to take care of the baby. By the time they are going in the morning, they express the breast into cup, well clean cup, and then they give the baby with cup and spoon while they are away. That's the arrangement. That's the economic, the counseling we normally give them, or they look for nearby daycare where they are working, so that during break time they will quickly go there to breastfeed the baby.
Some mothers cannot actually carry out exclusive breastfeeding as they find it very stressful, and then in the process the child doesn't even get the breast milk, and then they have to resort to other food. I want to believe that some organizations have maternity leave, and so for some people it's 3 months rather. So for the first 3 months they should be able to do that. Now if after 3 months they also advise they could express the milk maybe in a particular bottle, feeding bottle or whatever, so I keep it for the child to take.
I tried it for like 4 days. So all of a sudden, because my breast milk didn't come on time, so she just got tired, maybe because her throat was paining her or something. I don't know what happened. So I had to now introduce her to formula. So that was how she started taking formula till date. I actually advise exclusive feeding because it's very good for babies. So, but if your baby chose to take formula, that's okay.
I did the exclusive breastfeeding for my first son, but I didn't do for this one. The reason is because when it's time for them to eat, that is when they are 6 months, they find it difficult for them to eat. And as a result of that, I didn't want to do that for this my child. And second reason is that I'm having issue with my nipple, so I couldn't breastfeed him always. I give this one formula.
There is no mother that cannot practice exclusive breastfeeding, except when the mother is extremely sick or death of the mother. Usually, when a woman finds breastfeeding as a difficult task, when the woman has not really prepared her mind towards it, this should be done even before delivery. Even if you are an HIV patient, what we advise in the hospital is this: take your time to know your CD4 counts. Depending on the CD4 counts, and depending on whether the mother is adhering to the usage of ARV drugs, we do follow them up in practicing exclusive breastfeeding. With exclusive breastfeeding, you have a guarantee of 1 year of the child not being infected or being sick, depending on the mother's hygiene, and of course adequate nutrition.